Welcome to NICU in a Nutshell, where we talk about all things neonatal in a simple and easy way to understand. While this isn't meant to be medical advice, it is a place for education, questions, and community. My name is Anna. Let's get started. Is my baby in pain? How do I know, and what do we do about it? Research has shown that on average, a NICU patient gets 14 procedures per day. These procedures range from needle sticks to taking off adhesive and cause pain, discomfort, or stress for your baby. As the parent, you're keenly in tune to your baby and want the least uncomfortable and most pain-free experience for him or her. We're going to start by talking about how babies express their pain. Depending on how old your baby is, he or she might not be able to flinch or pull away from painful stimuli, so it's important that we have a broad range of things we look for a baby in pain. And I want to note, these are not just things nursing and medical staff can look for, but you as their parent can keep an eye out for as well. Something we often look at as an indicator of pain is heart rate. If your baby's in pain, oftentimes their heart rate will be elevated, and that can be one of our first cues that your baby might be in pain or uncomfortable. Another vital sign we can look for is oxygen level, especially if your baby's on supplemental oxygen, meaning they need oxygen more than what's found in room air. We sometimes see their oxygen levels on the monitor drop and requirement for supplemental oxygen to increase. This is another vital sign that could indicate that your baby's in pain. Occasionally, we will see blood pressure also increase in response to pain. Moving from what the monitor says to what your baby is telling us, there are some cues that your baby can give that he or she is in pain, uncomfortable, or stressed out. Most of this is facial expression similar to if you or I were in pain. They squeeze their eyes shut, furrow their brows, pucker their lips, and while it does look cute sometimes, we need to be aware that this could be a sign of pain or discomfort. Other things babies do to show us they're stressed or in pain is sneezing. So repetitive sneezes tells us that they're stressed out. Also, they do a stop sign motion with their hand. And it's very intuitive of them. They are literally saying, stop. And they'll hold their hands out, palms facing you, to say, whoa, let's take a break. So now that we've reviewed some of the things we look for a baby being in pain, what do we do about it? There are a number of non-pharmacological, which means non-medication ways that we can manage and treat your baby's pain that you can also do if you're at the bedside. The first is simply touch. Most babies, especially if they're premature, don't particularly like to be patted or rubbed. So simply just laying your hands on your baby, giving small amount of pressure can be very comforting to them, especially if they're premature. Think about in your belly, there's that containment they have of your uterus, placenta, amniotic fluid, everything giving them kind of a squeezing feeling. We can also replicate this with things like boundaries in the bed or swaddling. Hearing your voice is another way that we can encourage pain control and help with discomfort. Babies start to hear in the womb around 18 weeks gestation, so they have heard you speak every day from around 18 weeks until whenever they're born. So your voice is something familiar and comforting to them. So simply speaking to them, singing, reading, all of these things are a comfort to your baby. Another thing that you as the parent or caregiver can do is skin-to-skin contact, also called kangaroo care. This is when your baby's bare skin is against your bare skin. This helps with a multitude of reasons, which I go into a little bit deeper in our skin-to-skin video, but it does help the baby decrease their cortisol levels, that's their stress hormone. It helps temperature regulation, and it really helps mitigate that pain or discomfort response. One of my favorite non-pharmacological interventions is sucking. While it is your decision as a parent whether you allow your baby to have a pacifier or not, I highly encourage you to let this happen. Sucking is comforting to them, it decreases pain, and it helps them develop that suck, breathe, swallow coordination that we need them to have for bottle feeding. Sucking can not only be on a pacifier, but it can also be on the breast if you want to breastfeed. If the staff lets you put the baby to breast, that can help decrease pain as well. Going along with the pacifier is sugar water. This is simply as it sounds. It's a very sweet liquid that we either put on the baby's pacifier or sometimes we'll do a tiny little drip into their mouth. Now this sugar water, it's actually one of the most researched and founded non-pharmacological ways we can help your baby with pain. So the sugar water works on the same pain pathway as things like narcotics. It has the potential to work equally as well as medications in your baby's pain management. Sugar water, also called glucose, there's a brand called Sweeties, whatever your hospital has. It's been shown to be effective 2 to 3 times before a painful or anticipated discomfort from a procedure, as well as can be repeated throughout the procedure. The last thing we can do is the environment. We can turn down the lights, try to keep the noise at a low level, just to bring calmness and peace to your baby. While we do always try to start with the non-pharmacologic route, sometimes your baby does need medications to help manage their pain. We see this a lot with particular procedures like surgeries, lumbar punctures, total body cooling, just to give a few examples. We do use caution in pain medication administration because your baby's kidneys and liver, which process medications, isn't as developed, as well as many of these drugs can impact your baby's breathing, whether it's their drive to breathe or their chest wall. We call it chest wall compliance, so how easily the muscles in their chest move to allow them to breathe. We are very detailed in our monitoring of babies on these medications. Medications that we might use are opiates, like morphine or fentanyl, sedatives like Valium, and while sedatives do calm your baby, they don't work on the pain. Sometimes we might use this if they did get a surgical procedure or something that if they moved, it would cause more pain, to just kind of calm them down. One medication that we use that is highly effective, but not a narcotic, is IV Tylenol. Same Tylenol that we take as pills, but the IV version is extremely effective and not a narcotic. Last, we have local anesthetics like lidocaine. These are often used in things like circumcisions or lumbar punctures. Oftentimes, we'll have a combination of pharmacologic and non-pharmacologic interventions to make sure that we keep your baby as comfortable and pain-free as possible. Thanks for joining. Make sure you hit that subscribe button to join our community, and we'll see you next time.